Hi folks, my name is Dr. Abdul Mannan. I'm a GP in Rosendale, Lancashire, and I want to talk to you about why is it that you're struggling to get in to see us? Why is it that you can't get GP appointments? Why is it that you struggle to get face-to-face appointments? Why is it you can't talk to us, even remotely, videos, telephone calls, emails and so forth? Why is there so much trouble at the moment? You've probably heard a lot of media headlines at the moment, whether it's the Daily Mail, Telegraph, not that I like any of these publications, but they are amplifying this issue that people can't access GPs. Whilst I disagree with a lot of the spin that they put into it for their own political reasons, I do agree that people are struggling to see us. So let's have a look at why. From a personal perspective, my mum struggles to see her GP as well. She'll ring for appointments, there's no appointments left. You're right, after about 10-15 minutes past 8 o'clock, it's so hard to get appointments. She tries to get face-to-face appointments, she struggles. She tries to get telephone appointments, she struggles. So why is that? Is it because her GP doesn't want to see her? Is it because her GP just gets paid lots and lots of money and doesn't come to work? Is it because her GP is on holiday a lot? Is it because her GP is on the golf course? Is it because she's sat somewhere twiddling her thumbs? What's going on? So with all this stereotype that's actually hyped up by the media, you find that people are very angry, and unfortunately what you get is a lot of people, I know colleagues who've been stabbed on the way to their cars after work. I know colleagues in reception staff who've been beaten up because people are angry, people are upset, and there's absolutely no excuse for this kind of behaviour. But the reality is, because of mainstream media and there's so much toxicity going on out there regarding general practice and the staff, people are becoming violent and nasty, really, which isn't warranted. It's right to express frustration, but that shouldn't happen. But really, why is all this happening? In reality, right, I can tell you today I'll be doing easily a 10-hour day, right? Most of my colleagues that I know are genuinely hardworking colleagues. My mum's GP isn't lazy. My mum's GP isn't overpaid. My mum's GP doesn't go on holiday a lot and does not abuse her position. She's actually busy working every day in her practice. Even at home, through her online laptop, she's having to access workplace to do pathology results, letters and so forth. All of these things have to be done even in your own time. In reality, we are clocking up 10, 12, 13-hour days, which is actually unsustainable. So then they get the question of, why are some GPs supposedly doing part-time work? Well, actually, look, there might be some GPs doing 3 days, but when you then add up 10, 12-hour days, then you do the maths. It's not actually part-time, it's more like full-time, right? But most GPs are actually not on part-time. There's actually loads of people who are doing full-time, 4-day, 5-day jobs, and it's absolutely exhausting. It's non-stop. It's relentless, the amount of work that you have to do. So it's not that my GP doesn't want to see my mum. It's not that she doesn't want to offer face-to-face. It's just the volume of work is so much that when you've done a 12-hour day, 10-hour day, where you've done loads of face-to-face, where you've done lots of telephone calls, video calls, managing these e-consults that come in, emails and online consultation queries coming in for patients, when you've managed hundreds of pathology results, hundreds of letters every day in the practice, which all need action, all need looking at by clinicians, you just don't have the time. Okay, now that's really the reason why people are struggling to get in. That's why my mum can't get the appointment that she wants. The reality is, guys, that in the last 20 or so years, the population in the UK has spiraled. And if you look at statistics, go online and have a look, you'll find the population's gone up by easily 10-15 million in the last 30 years. In that time, ask yourself, has the GP surgeries, number of GPs and number of GP surgeries gone up by 10, 15, 20% in your areas? You ask yourself, wherever you live, have a look around, ask yourself, have we got an extra GP surgery? Have we got 2 or 3 extra GPs in the area? Have we got extra staff in primary care, like nurse practitioners, practice nurses, people like that? So if you reflect, you'll find actually, no, there isn't those extra GP practices. In fact, you'll find, if you look around, that the number of GP practices has reduced in many areas over the last few decades. And the reason for that is many, and I'll go into that later. You'll actually find the number of GPs has actually gone down, all right? Because people are actually exhausted, they're knackered, all right? I've got friends who are leaving the UK. I've got friends who are actually quitting the job. One of my friends has become a plumber because frankly, you get paid more as a plumber than as a GP these days. So the Daily Mail might tell you that we earn like 6-figure salaries and that we earn, you know, all sorts of this and that. But the reality is your average GP isn't on that type of income. It's a complete farce. You can actually look at your practice's website to see what GPs earn, and you'll actually be surprised to find most of them earn far less than Virgin train drivers. So coming back to the issue of population, the population has mushroomed, right? And there's fewer of us to do the job. There's fewer practices to do the job for various reasons, political and non-political, right? You've got, you know, this move towards super surgeries where people are losing touch with their own GPs because you now have big glass buildings where lots of people work from, but you've lost that personal touch as well. And again, that's something that really the people higher up need to look at. On top of all of that, guys, the reality is, and these aren't my figures, these are NHS England figures, these are government figures, you'll find that in the last 18 months, GPs have actually been doing an extra 1 million consultations every week. So instead of 6 million, we've actually been clocking up over 7 million appointments every week. You tell me, is that sustainable, right? Now, appointments are going up all the time. We just can't keep up with the pace. There's that much demand put on us. We just can't meet that demand. And that is the problem. Care as you know it is not the same as it used to be 20, 30 years ago. Nowadays, GPs are having to manage more complex care. Rightly so, right? So for example, patients want to die in their own homes amongst the loved ones. We're having to provide more complex palliative care, which previously were done in hospitals. Nowadays, I say that we're actually managing the wider edge of the wedge, so to say, because for a given condition, you have to manage a lot more in primary care. If you've got heart disease, heart failure, if you've had a stroke or whatever, most of your care will be provided by GPs in your practices. We use our hospitals far less. And it's all right to do that, but actually you need more people, you need more resources to do that, but that hasn't followed. So you have people being discharged from hospitals a lot quicker. They also need caring for. People have operations and they get discharged quicker. People don't go into hospitals as often. These things can be managed more in the community. But who does all of that? Who provides all of the complex care? So have a think about it. So these things take up a lot of time. An appointment, for example, looking at chest infection might take up 10 minutes. But when a patient, an 85-year-old comes to me with 2 or 3 problems, I can't send her away easily, all right? I can't say go away because 10 minutes are up. You deal with it as best as you can in most circumstances, but it takes time. And those problems aren't just a cold and a cough. They can be complex. You know, a heart issue, a mental health issue, a respiratory issue. It takes time. It can take up half an hour, 40 minutes of your time quite easily. And that's why we can't get around to seeing everybody that wants to see us every day. Many of my colleagues also work in areas nowadays because we've had such a growth in population and people from different backgrounds who can't necessarily communicate with us easily. So they have language needs, for example. You know, I've got a friend of mine who was needing to call language line 15 times in the day because he had to deal with 4 or 5 different languages. It takes time to do all that. There's a logistical issue there. There's an admin issue there. So it's not easy just clocking on and clocking off, you know, 10 minutes, 10 minutes, 10 minutes. It takes a lot of time. Now, what did we do during the pandemic? Did we go home? Did we disappear? Well, during the pandemic, the reality is, and again, that's contrary to popular belief, that we weren't seeing patients. If you look at NHS England statistics, actually 60% of interaction with GPs was actually face-to-face. And I'll tell you why. During the pandemic, as you know, people fell ill. A lot of people were ill. You always heard about people who got admitted to hospital, right? Who needed hospital care. They were on the wards. They were in the ICU. People were sadly dying. And understandably, those figures were amplified in the media. What you didn't know is that actually 80% of the people who didn't need that kind of care also needed some kind of intervention. Now, a lot of people managed on their own. However, of that 80%, more than 60% of those people needed some form of help on the phone, face-to-face, and management by somebody. Who did that? Ask yourself who did that. They did not go to hospital. They actually went to their GPs and got managed either on the phone or face-to-face. Face-to-face, for example, in my own practice, I had an amber room, right? In other areas, they had hot sites, i.e. GPs set up new sites where they could see these patients. There's all that work going on at the time. It was a government directive that we stop other kind of work temporarily so that we can focus on COVID-19. It wasn't because the GP didn't want to. And in reality, the GP wasn't sat there doing nothing. They were actually doing a lot of work in the hot sites, in the amber rooms, looking after COVID patients, and really keeping the practice going, because the chronic disease work, all that had to continue. Now, besides that work, you find that a few months in, if you remember, the vaccination campaign started. Now, that needed a number of months where we all, as GPs, worked with our CCGs, the NHS England, to set up those clinics. And to date, you'll know that 75% of all the vaccinations in the UK were actually delivered by GPs and their teams, right? Now, these people didn't just materialise out of nowhere. They had to find time out of their day-to-day work and do it in addition as well to deliver that work. And now in the UK, the one thing that worked well in the UK, the vaccination campaign, was mainly run by the GPs. So we have to think really about vilifying GPs and whether it's fair. We're already at the moment working on the booster vaccination programme. Even though that's not started, it needs a number of months to set it all up, and we've been behind the scenes working actively on that. The flu campaign as well is going on, despite the fact that we've got the booster campaign to think about, and we've just literally come out of the phase 1 and phase 2 vaccination effort. The system is under pressure overall, guys. I mean, it's not like the GPs are working and the hospital colleagues aren't or whatever. I'm not going to stand here in front of you and say it's such and such's fault. It's not. The reality is our hospitals are stressed out as well. That's why A&E departments are full, urgent care is full. It's not because the GP is lazy. No, the GP is full. The GP surgery is full. The A&E is full. Urgent care is full. The ward is full. There's not enough GPs. There's not enough hospital doctors. There's not enough nurses to look after you. Why? Because it's a system problem. It's because our government does not invest enough in the NHS. The UK invests circa 7% of its GDP in the healthcare system, whereas a country like Germany invests something like 12%. Now you do the maths, you look into it, right? The UK does not invest enough. It does not keep enough beds. That's why we have all the bed shortages as well. It's not because, somehow the GPs steal all the beds and take them home. No, it's because the government does not want to have enough beds, enough ICU beds to look after the population. It's because the government does not invest enough into social care to look after our patients well, our community well. That's not the GP's fault. So we have to look at it as a system thing. We have to lobby our MPs. We have to lobby our government. We have to tell those broadsheet newspapers to shut up and not vilify people. And we have to stop torturing each other. Thank you.